I'm a registered nurse. I've been a nurse for 38 years. Spent the first 22 years in the emergency trauma room at a level 1 and the last 16 years in the recovery room at a level 1 facility. And I've been with Dr. Toll for probably 20 years. Well, I actually met Dr. Toll probably about 23, 24 years ago, and she tried to convince me to come see her since I'm a dental phobic, and it probably took her 2 or 3 years to convince me. I finally did come to her as a patient, and that developed into a friendship and working for her. It began as an as-needed basis. And I was so impressed with her facility and what she did for her patients that I've been with her for 20 years. It's probably one of the safest facilities I've worked in. And it's a joy to work for the staff here. And the treatment we give our patients is pretty amazing to get them through. For most people, it's a really, really tough thing is to walk in here and get the dental care that they've needed for most of the time, years and years. Dr. Toll goes to great lengths to make sure that her facility is safe as you would be in a hospital setting. All the staff here are CPR trained. Some of the dental assistants are ACLS. I, as an RN, I have PALS, which is Pediatric Advanced Life Support, ACLS, CPR. We only use board-certified MD anesthesiologists here. So we have all of the safety equipment that would be needed. Our patients are monitored continuously while they're here. Their EKG, their heart rhythm, their oxygen level, their blood pressure. We have resuscitative drugs here if needed, which we've never needed in the 20 plus years I've been here. So it's safe. Our staff, we go through drills on a regular basis. Everybody knows their role. If there's an emergency that may require the patient being transferred to the hospital, everybody has their role. Everybody knows what they're doing. And I couldn't work in a safer place than at Dr. Toll's Center. What makes working here at Dr. Toll's office unique is her patient population. And our patients can be just dental phobics to medical disabilities. They don't have the ability to lay in a chair. They can't tolerate the duration that it would take. So our population is quite diverse. And I think the exciting thing about it is that when they come back for repeat visits, you can see the trust that they've developed in Dr. Toll because she does what she says she's going to do. So with each visit, it gets easier and easier. You see their stress go down. On our patients that aren't able to communicate to us, you see smiles on their faces, which you hadn't seen before because their pain's gone, their dental care has been taken care of. And that's probably the best thing working for is to see the difference in her patients over a period of time. And because of the various needs of our patients, we can offer several different ways to make their visit comfortable, less stress. We can do oral sedation where our patients can get medication the night before and the morning of to help them relax a little bit. When they come in, we can do IV sedation where we start an IV on the patient. They're still hooked up to all their monitors so we can continue to monitor them while they're being sedated. They are aware, they can hear us, but they really don't care. And sometimes they may drift off to sleep, but the bottom line is they're not having pain, their stress is gone, their phobia is gone for that time period, and they wake up and they're happy.